Check, check, checkity, check, check. All right, we're good. Okay, let's do this.
Hello and welcome to the video training portion of the California Patient Movement Plan. My name is Tiffany Cannon.
And my name's Kelly Coleman, and we are really proud and looking forward to bringing this incredible plan to life. So the California Patient Movement Plan has been published for about a year, and many people throughout the state of California have worked on this. And so this is the next logical step for us, is to do some training modules on the plan to socialize it.
This is Phil. He is our expert on patient movement throughout California. He is going to share with us his knowledge during the next 5 training sessions.
Oh, he's a cute little guy. Thank you. All right. So the California Patient Movement Plan was published late in 2018, and is really a strong collaboration between the California EMS Authority and the California Department of Public Health. And really, these two agencies came together with many local stakeholders, people up and down the California medical and health system, including hospitals, EMS providers, local EMS agencies, all produced this framework for patient movement in California. How do we coordinate all together when we're talking about moving large amounts of patients throughout the state? So let's go into some of these different concepts. So the state of California, first off, has several operational priorities, and these are really important to the plan, and it informed everything that we did within the plan. So priority number 1 is to save lives. We really can't go anywhere if people are dying and lives aren't being taken care of. So priority number 2 for us also is to protect health and safety. So that's the main 2 priorities that the plan focuses on, is saving lives, protecting health and safety. So as a lot of you know, when we have a large-scale medical or health incident, 911 calls go crazy. The public needs answers. There's many patients that need to be treated, and there's a huge response that goes on. So that's all chaotic and confusing. So what we want to do within this plan is try to bring organization to the chaos. Really, the definition of what triage is bringing organization to chaos. So there's 5 essential functions of the plan, and that's patient evacuation, patient regulation, en route medical care, tracking, and repatriation. And so we'll break some of those down in the next couple of slides here. So function number 1 is patient evacuation, and this really refers to the evacuation of patients from a healthcare facility or an impacted area, or it could even be from an EMS staging area or some sort of a field treatment site, and evacuating those patients to definitive care. Secondly, regulation refers to coordination of transport, and then also where are we transporting the patients to. So we want to arrange the correct transport, and then we want to arrange the correct receiving location so those patients receive the right kind of care. So function number 3 that the plan addresses is en route medical care. And this is really the provision of medical care during the transport process. If the patient is a critical patient and needs a high level of care, we want to make sure that we're providing that level of care for that patient en route to the hospital. Number 4 is patient tracking. So this is the ability of a patient for us to follow a patient's path from their point of origin, whether it be the field or the hospital, to their final destination, and never losing a patient. The last thing that the plan addresses is repatriation, what some would also call repopulation. And this is making sure that every patient returns to their originating location, safe and sound, all whole and in one piece. So let's talk about a couple of other overarching aspects of the plan. So the first aspect is the incident level. So the plan talks about 3 incident levels, level 1, 2, and 3. Level 1 being the highest activation level. So this is really where a mutual aid region and a county oversees their capacity to respond, and then they have to call on the state and multiple surrounding regions to help. Level 2 is really handled within whatever the mutual aid region and the operational area that is responding, and level 3 is sort of a day-to-day, response. So who does this plan apply to, Tiffany?
This plan applies to local emergency medical services, various healthcare facilities, the Medical and Health Operational Area Coordination Program, also called MOAC, the Regional Disaster Medical Health Coordination Program, state agencies, and federal agencies.
Yeah, and we'll talk a little bit more in coming slides about what the MOAC program does and what the RDMHC program does.
This completes the introduction portion of the California Patient Movement Plan. We'll see you in section 2.
All right, sounds good.